Good morning, good afternoon, good night, wherever you guys are standing at. My name is Jorge Hernando Ulloa. I am the president of the Latin American Venous Forum, and I work as a vascular surgeon in one of the biggest hospitals in Bogota, Colombia. Right now, I am at Porto in Portugal, in the middle of the European Venous Forum, and we are going to present the factors that influence the adherence and efficacy of medical treatment, what we have been calling it the Vein Act program. This is an effort that comes with the help of Servier, who put all the support and logistics in order to organize our group and the group of other countries in order to achieve this possibility of getting the recruitment of the patients. Chronic venous disorders management and evaluation of chronic venous disease treatment, effectiveness, and international program is the acronym that comes after the name Vein Act. This has been under the auspice and support of the European Venous Forum and, of course, Servier International. We made it an official topic for our association, the Colombian Association of Vascular Surgery. So we put together vascular surgeons and general physicians that belong to the association in order to make all the recruitment of those patients. Those are the names of the leading vascular surgeons, most of them ex-presidents and former presidents of our association that are dealing with it and organizing, trying to lead and show us the way of how to do that. The experience of the Vein Act was split in two arms, one handled by general physicians under our supervision and another vascular surgeons directly by us. 69 general physicians in one arm, 44 vascular surgeons on the other. The number of patients recruited by the general physicians were 1,570, and the number of patients recruited by vascular surgeons, 1,460, for a total of 3,030 patients. A little bit information on geopolitics of Colombia. Colombia is a country that is located in the top part of South America. It has border with several other countries and has two oceans, the Pacific and the Atlantic. Our country, it's going to be 50 million in a couple of years, and the population is fairly young, between the ages of 15 and 55 is most of the population, almost 50% of the population, with a 22% of our population below 14. It makes this country a very, very young country, and is the third most populated country in Latin America after Brazil, who occupies the first position, and Mexico, who is the second one. Colombia is the third largest country in the number of people. The life expectancy for 2020 is going to be 78 to 79, and our population is constituted, most of it, by mestizo white people. There is almost a 9 to 10% of African Colombian or African Americans, and the language we speak is mostly Spanish in a 99.7% of our population. One invention that came from the guys of Wall Street, the people from NASDAQ, is the Big Mac Index. The Big Mac Index is something that tells us what is the acquisitive power of a country. So when you go to a McDonald's and ask for a Big Mac, the price in Colombia is $3.34. That puts us into an upper middle income economy. Those are images of our preliminary meetings that we did under the society and our association. We did more than 4 meetings trying to put together general physicians and vascular surgeons who will be in the process of recruiting the patients. So we try to talk in the same language, try to revise and go over and over again through the paperwork and all the forms that we need to fill in order to make it pristine in the process of recruitment of our patients, so we lose the less number of patients in the follow-up. The agenda of this presentation is a global presentation of the Vein Act. It's the first time we are going to show you guys the preliminary reports we are achieving to that, showing you the objectives, the type of design of the study, the methodology that we follow, the type of patients we get, and the limitation of the procedure, the limitation of the treatment, and to share experiences with other countries, and of course be preparing your questions so at the end of my presentation we can inter-exchange them to make it a little bit more interesting. The objectives of VANE Act is to help physicians, patients, and the scientific community to assess compliance with no operative treatment of chronic venous disorders, to assess also the effectiveness of non-operative treatment and symptomatic adult outpatient with chronic venous disease in the framework of ordinary general physician and vascular surgeon consultations. So we focus into the importance of symptoms and the importance of daily activity. The design is a very simple design. It's an international observational prospective multi-center survey that was carried out in 7 countries: Austria, Central America, constituted by 5 countries that we put together into one: Colombia, Romania, Russia, and West Indies. We included in this study 7,000 patients. The rationale behind this is the selection of patients consulting general physicians and vascular surgeons, and because of complaining of pain in the lower limbs. And the inclusion criteria is a patient that presents with more than one venous symptom or sign, or both at the time of inclusion of the visit 0, the visit number, the first visit, which is called V0 in our codes. The prescription of non-operative treatment, and at the end of non-operative treatment, a follow-up visit to assess the compliance and the satisfaction. You see in the bottom of your screen a V0 and a V1. V0 is the code we say for the baseline visit, and V1 is the follow-up visit. This is the product we use. That's the presentation of the product in our country. It's a package of 30 sachets of Daflon 1000. Signs and symptoms. The vein consult program allowed to identify several things: 4 symptoms, as heavy legs, pain in the leg, and swelling, and 3 main moments during daytime where the patient arrived to this. And of course, we did all the measurements by using the SIP classification. The criteria, 2 main criteria. First one, the evaluation of adhesion, how the patient behaved to the treatment, how he accepted that, and the non-surgical treatment of CVD using a visual analog score, lifestyle change, compression, and the criteria number 2 is the efficacy of non-operative treatment as symptoms, quality of life, and patient satisfaction. The materials and methods. We performed the recruitment between March 2016 and April 2017. As I was telling you before, 44 vascular surgeons and 69 general physicians were into the group that recruited the patients. We all members of Colombian Association of Vascular Surgery. The time of during the whole process were 60 days for the general physicians and 90 days for vascular surgeons. Most of our patients fall into the category of C2, C1, and C3. 37% of the patients had already been consulting a doctor, and it calls our attention that 35.5% had previously been treated somehow by those problems. The results, we achieve almost 100% treatment in all cases, advises and venoactives in 24.3%, and advises compression and venoactives in 48.3% of cases. For almost 57% of the cases, venoactives were prescribed for more than 9 weeks. Mild and moderate compression was prescribed in our patients with a classification of 1 and 2. We emphasize the use of classifications of this class 1 and class 2. It's not millimeters of mercury, it's class 1 and class 2. And we also emphasize the use of them regardless on the weather and the humidity and the environment of the country that you are located at. It is very important, this part. Stockings were preferred, of course, over bandages in almost 96% of the cases. And the results, we showed heaviness relief in 28.3%, an improvement in swelling in 37%, and improvement in cramps in 44%. And most of the patients qualify the process as extremely or very satisfied in combination with other treatments for a 72% in average. We're going to show you some data about the comparison between the results we got from general physicians to the results we got from vascular surgeons. Those graphics that I'm going to show you are beginning to show the number of recruiters, 69 for the general physicians, as I was mentioning before, and 44 vascular surgeons recruiting for a total number of 3,030. It calls our attention, as you see in the table, that a general physician lost during follow-up only 8 patients, while we lost 31 patients. Something is happening during the procedure that the general physicians are doing better than we do in order to continue the follow-up. 60 days is the average follow-up for them. 91 days is the average in our hands.